Good morning, students. Today I am continuing the topic IEC, Information Education Communication Approaches. We started last class. There are 5 levels: mass level, community level, group level, family level, individual level. Okay, mass level means health education we are propagating through a large public through different mass channels like television, newspaper, social medias, then health exhibitions, and any such mass level media of health education. So large number of audience can be the beneficiaries. Okay, government will use this channel for propagating the health messages to the public, especially through newspapers and magazine. Even health magazine can use. Community level health education can be given to a focused community with the felt need. So a specific health need related health message. For example, a particular community having water pollution. Okay, their water source are contaminated with any pollution. So there we can give chlorination of well or such purification of water health education along with the participation of community members we can give. Okay, particular community, their felt need is safety of water. Okay, so likewise we can give. Then group level. So in a community we can see different groups are there like antenatal mothers, postnatal mothers, then school children, adolescents, old age. So these are different groups we can select, and based on their group need. For example, antenatal mother need antenatal advice, how to take care of the baby, immunization, all they need, curious to know about these aspects. So for them we can call and assimilate in one place. For example, antenatal mothers in antenatal clinics we can do. Then family level, family is a place where family members are living, and it is a good place we can provide privacy, and health educator and family members can communicate very well. Okay. Then individual level is a personal level communication where face-to-face contact is possible. Family health educator can directly see how the individual is receiving the information. Direct feedback is possible. So these are that's the approaches. Then coming to the health education definition. Health education can be defined as a process aimed at encouraging people to want to be healthy, to know how to stay healthy, to do what they can individually and collectively to maintain health, and to seek help when needed. Okay, it's a process of encouraging. Okay, those who want to help, we can give education about how to stay healthy. Okay, some measures we can give through encouraging measures. So it can be individually or collectively, so that people can maintain health whenever they need help. Okay, so helping in the sense like encouraging people to want to be healthy, to know how to stay healthy. So this is a definition given by Alma Ata Declaration, WHO 1978. Then coming to the aims and objectives. There are mainly 4 objectives are there: to encourage people to adopt and sustain health promoting lifestyle and practices. Okay, that is health lifestyle and practices. Okay, promoting good healthy lifestyle that we are encouraging people to adopt. Then to promote proper use of health services available to them. Okay, health services available to the community that we can promote through health education. Then only people will come and access the health facilities. Okay, then to arouse interest, to provide new knowledge, improve skills, and change attitude in making rational decision to solve their own problems. To make interest. Okay, health education should be interested way, so that people will learn new knowledge. They will improve their skills, even attitude. We can change attitude of people in a slow manner with the help of health education. In condition where it should be interested. Okay, interesting topic. Then, to stimulate individual and community self-reliance and participation to achieve health development through individual and community involvement at every step from identifying problems to solve them. Okay, so to stimulate, okay, to boost the individual and community. Okay, every community have their own self-reliance, their own self-power. They have some control over their own health. So only through that, health education is the only mode or channel or method to develop the individual and community environment. With the participation of community members, we can stimulate the community empowerment. Okay. Then coming to the next health education aspect. Approaches, different approaches, mainly 4 approaches. Regulatory, service approach, health education approach, primary healthcare approach. We'll see what is regulatory. Regulation means imposing some rules or regulations. Okay, government can make some law to protect the health of the public. Okay, anytime government can make some laws and regulation. During this period, I think day before yesterday, government passed an ordinance against spreading of infection. There is a law, it includes those who are spreading infection. They will impose a fine of fine money as well as 2-year imprisonment. Okay, so it's during the emergency period it will be applicable, and some very good examples of regulatory approaches are seat belt. Okay, compulsory seat belt wearing and other like Food Adulteration Act. So there are many, even Child Marriage Restraint Act. These all laws will protect the public from ill effect of certain behavior, health behavior. Okay. Then coming to the, I hope you all get the regulatory approach. Okay, nowadays cigarette smoking is prohibited in the public place. Okay, only public place, but we cannot causally or we cannot forcefully say that cigarette smoking is prohibited because people won't accept it. Okay, it is individual choice. They can smoke in their own places where privacy it is there, but it is not allowed in the public places. Okay. Then coming to the service approach. This approach is used in 1960s. Okay, where health facilities is provided in the doorsteps itself. Based on the felt need, services is provided in their doorsteps. Okay, with the assumption that they will consume the health facilities, they will utilize. But we cannot sure that they will utilize or not, because some people may take it in a very positive way. There are chance to neglect. Okay, based on okay, that's about service approach. Okay, next is primary healthcare approach. This is a very good example of propagating approach of health education. Primary healthcare elements, we know that community participation. With the participation of community, we can plan healthcare services and we can deliver health services. Okay, immunization services, antenatal care services. With the public participation, with the community participation, we can provide. Okay, so only thing we can give necessary guidance to people. Okay, and so that with this approach, people will identify their problems. Okay, they will come forward and they will find the solution because their participation we are welcoming. Okay, so there are different approaches in primary. There are different solutions for primary healthcare approach. Okay, in primary healthcare approach, we are utilizing intersectoral coordination, we are equitable distribution, then community participation, scientific technology. All these principles we are using in the healthcare approach. Then coming to the principles of health education. Principles of health education, it is very important for your examination point. There are mainly 12 principles. Okay, you can make a synonym of creating a word or like that. So first principle is credibility, interest, participation, motivation, comprehension, reinforcement, learning by doing, known to unknown, setting an example, good human relation, feedback, and leaders. Okay, first we see credibility. What is credibility? Credibility means whether it is true or false. Okay, what is the degree of information, or what is the degree to which the message is perceived as trustworthy by the receiver? Okay, nowadays we can hear many information. Okay, like about corona, their prevention strategies, many things is coming through social media, like it is good, it is bad, it is like that. But to make sure that we always rely on government, okay, government as well as health authority. Okay, they are the reliable sources. We can believe their messages. Other messages like unknown person is audio message about corona. We cannot rely who is the person. Okay, the genuinity of the messenger, it is uh, it is what it's not there in the message. Okay, about the truth of the message, it should have a scientific basis. Okay, so health educator, keep in mind that the message should be credible, in the sense it should have a scientific basis. Okay, and also make sure that it should not hurt the local culture. Okay, it should be always adhere to the local culture of the community. It should not give any hurt. It should not interfere their local culture. It should be adaptable. Clear for you, I think. Then next is interest. If the health education topic is interest to the people, they will listen to it. Health education should identify the felt need of the people and then prepare a program that they can actively participate in, make you do it. Okay. Okay, for preparing a health education content or topic, always we have to identify the felt need. If they have a real interest on the topic, they will listen. Okay, if they are not interested on topic, definitely they will neglect. So identify the interest and make the health education. So it will more it is always keep in mind interest of the people, that we have to keep in mind. Participation. Without participation of public, health education won't be effective. Okay, in a classroom we know that students without actively participating, class will be monotonous. All lecturing is always people won't interested. Okay, so to modify the lecture method, more interested in way that we can always encourage people discussion. Okay, we have teachers should always give opportunities for discussion. Okay, allowing them to ask doubts. So these are the way we can improve participation. So health education definitely is one of the essential criteria, participation. Okay, so always give a chance to people to take part in their program in an active way. Okay, the next, motivation. Motivation, without motivation, health education won't be success. Always we have to go behind the people and motivate. Every people have a fundamental desire for learning. Okay, so that desire we have to ignite, or that we have to boost their learning desire. Okay, for example, for a teenager, aesthetic might be a motivation for them to take care his teeth, whereas an adult, this may be a expense for undergoing a restorative care. So based on the individual interest, we can motivate. Okay, then coming to the next aspect, comprehension. What do you mean by comprehension? Comprehension is understanding. So while providing health education, we have to understand their literacy level, their understanding level. Then only we can plan the health education. Especially words should be very simple, and the message should be very simple, and it should be understandable to them. Okay, don't use any technical terms or medical terms while giving health education. Understand the people, whether they are following or not. No, our language is enough. It is so easy. Okay, that's all about remaining principles. I will deal in the